So Alan's just showed me a message. He's had a big night and he's fallen down, cracked one of his teeth. He's really worried. What should he do about it?
Dude, cracked teeth are tricky, and you can go to 10 different dentists in Perth and you're going to get 10 different recommendations on how to treat a cracked tooth. And like we discussed many times, that's because cracked teeth are really difficult to study in a lab. So interestingly enough, dentistry hasn't really come up with a definitive solution for cracked teeth. They're really, really tricky to treat well, okay? Run us through some of the techniques that we were taught, for example, in university that a lot of people are still doing versus the more modern techniques.
Yeah, exactly right. There's so many ways we've been taught. So old school way was tooth's got a crack in it, you wrap it up in some metal, you put a big metal band that's like pre-formed so it doesn't custom fit to your tooth, you kind of like just wedge it onto your tooth, and it's meant to hold the whole tooth together. But we kind of know it doesn't do anything, because if you've ever seen a crack on a windscreen, once that crack starts, it just keeps creeping longer and longer until it just breaks.
Yeah.
So that treatment was very unsuccessful. We still see people doing that treatment today.
I have patients come in all the time with stainless steel bands on cracked teeth, and you know, I mean, we were taught that 15 years ago, but things have changed a lot.
Things have changed a lot. And the main thing is the glues that we use, the adhesives, we can glue the teeth back as strong as teeth are glued to themselves. So we can staple these teeth back together and really reduce that crack growing. It's really hard to eliminate that crack. Even if we try clean it, we drill it all away, we know microscopically the crack is still a little bit there.
Yeah, exactly. I mean, the classic thing with a cracked tooth is it's going to cause pain on biting. And the reason is that as we bite together, the tooth flexes open at the crack and you get movement of fluid through that crack. So the tooth's actually moving. So the treatment should be to stick that tooth back together, to bond it back together. How do we do that these days?
So the way we try to do it is sort of like, we used to do a crown back in the day. We used to cut all the sides of the tooth. We're left with like a little stump, and then we put a helmet over the tooth.
Which is crazy.
Which is crazy because we just lose all the strong part of the tooth, all the healthy bits of the tooth.
The problem is the tooth is flexing, and as you cut more tooth away, you get rid of all the hard enamel, the tooth's going to flex more.
Exactly. And then the result's that the tooth just snaps in half. You lose the tooth. And that the goal is for us, you crack your tooth, we want to keep your tooth there as long as possible without any pain and without needing a root canal treatment, which sometimes we just have to do. If the crack has gotten into there, the bacteria inside on the tooth, the tooth's very painful, we have to do that.
To me, the easy way to treat a cracked tooth is to do a root canal. But as soon as we do a root canal, that's a lot more cost for the patient. And so to me, when a patient comes in, the ultimate challenge is how do I fix this cracked tooth and avoid a root canal? And we're not always successful, but that's the aim of the game.
Exactly. The nerve does so many good things for the tooth. And one of them is it puts lots of water in the tooth. And the water lets the tooth flex and bend and move with all the different forces and the chewing and the grinding and all that stuff. So we keep that nerve there. That's going to really keep that tooth around.
Yeah, I think a good analogy is like, it's like a dead tree where it just becomes brittle, the branches just snap off really easily. Once that nerve's gone and all that nourishment to the tooth is gone, the tooth doesn't function like it used to. So we really want to hold off on a root canal if we can.
Exactly. The benefit we have here is we do same-day dentistry. So often if you had a cracked tooth and we'd shape the tooth and send like a mold or a scan away for a porcelain restoration, which is the ideal solution, because the porcelain is much stiffer and it'll staple that tooth together. Normally we'd have to wait 2 weeks to get that back, and in that time you don't know what's going to happen to that tooth.
Yeah.
But if we can do it in an hour or two, then because the success of that tooth being in your mouth is so much higher.
I reckon another key point is that a lot of people who come in with bad experiences in the dentist in the past, they hate the dentist, and often it's because they've had a cracked tooth, a root canal and a crown done, and it's failed 2 years later. And I think that's a really important discussion that you need to have with people up front is this tooth worth spending money on? If it's really badly cracked and the crack goes down the root, I don't want to see someone spending $3,000-4,000 on a root canal and a crown when there's a risk of that failing in 2-3 years time. And that diagnosis and having a look at the tooth and trying to work out, like, is this worth saving? It's so critical. And I think the problem is a lot of people in dentistry, we just look at it like a robot. Cracked tooth, let's do a crown, let's do a root canal. But there's no thought into where are we going to be in 2 or 3 years time? How long is this going to last? And if we're not confident it's going to last a long time, then why would you spend money on it?
So what should Alan do? What's the best course of action for him?
100% book an appointment with his dentist as soon as possible to have it checked out, test the nerve, test how that tooth is in function, and just see what the options are.